Since 1995, the UW Medicine Travel Clinic at Hall Health Center has been providing expert travel advice to the greater Seattle community. You don't want to spend your vacation here. You want to spend it seeing the sights or taking an adventure. Hi, I'm Ann Terry. I'm a specialist in travel medicine. This video will discuss the causes of traveler's diarrhea, how best to prevent it, and how to treat it if you get sick. Diarrhea is most commonly caused by ingestion of food and water that has been contaminated with bacteria. In rare cases, viruses, as well as parasites, can also cause diarrhea. There is a higher risk of contracting diarrhea in a tropical and less developed setting due to poor sanitation, contaminated water sources, and improper food storage. Luckily for most of us, diarrhea is self-limited and resolves with simple measures such as hydration. Here are some tools to help you minimize your risk. Wash your hands before eating. We recommend using an alcohol-based hand sanitizer. Soap and water can also be used, but is generally less effective. Make sure that you eat safe food and drink from clean water sources. Most travelers follow the mantra, boil it, cook it, peel it, or forget it. Avoid eating raw foods or unpasteurized dairy products. Do not eat food prepared by hand like sandwiches and salads, and avoid foods with questionable refrigeration like street vendors and buffets. Bottled, boiled, or filtered water are the safest options. Avoid drinking water from the tap, ice made from tap water, or using tap water to brush teeth. A treatment plan for traveler's diarrhea should be discussed with your travel provider prior to travel. We encourage travelers to carry loperamide or Imodium and a prescription antibiotic that is appropriately prescribed based on the patient's age, chronic health conditions, prescription medications, and destination country. Mild diarrhea is characterized by 3 or 4 unformed stools in 24 hours with mild cramping. For this condition, we recommend drinking clear fluids. Loperamide or Imodium can be added to decrease gut movement, giving you time for travel or sleep. Start eating as soon as possible. It is best to start with easily digested foods. Eating is the best way to regain your strength and stop the diarrhea. Moderate diarrhea is increased frequency of unformed bowel movements, often presenting with low-grade fever, abdominal cramping, and/or nausea. For moderate diarrhea, we recommend self-treatment with loperamide, followed by an antibiotic prescribed by your travel medicine provider. These antibiotics include azithromycin, ciprofloxacin, or rifaximin. We also recommend the use of oral rehydration salts to help with dehydration. Severe diarrhea is often unresponsive to self-treatment with antibiotics. Additional symptoms may include high fever, abdominal pain, vomiting, and blood in the stool. If you experience these symptoms, we recommend urgent evaluation by a local healthcare provider. We want to ensure you have a great vacation that isn't interrupted by traveler's diarrhea. Remember to always ingest safe food and water sources and carry treatment. This includes oral rehydration salts, loperamide, and antibiotics. If you're not getting better with those above treatments, you should seek medical care. Have a safe and healthy trip.